Okay, this is Eitan Shalom. I'm back with my friend Harlan, who has sciatic pain and low back pain that's most likely from a small bulging disc that's already improving. And actually, what I've done so far is release the motor points of the upper trapezius, because that relaxes the low back and pelvis. And then I have released the motor points of the quadratus lumborum. And then I've needled the small paravertebral muscles that connect bone vertebra to vertebra. And I've done that at L3-4, L4-5, and L5-S1. I've also needled the ligaments between the spinous processes of the same L3-4, L4-5, L5-S1. And I got really good releases on, especially on the left side, which is more spasmed. This is the side where he has the pain. And for balance, I did what I'm now about to do on the left side. I also did the fascia just above the PSIS, and I did the glute medius and minimus. So now I'm going to do the same thing on this side, but here I'm also going to do the piriformis and the quadratus femoris, and I'm going to do motor point on every place where the sciatic nerve can get entrapped. So I'm also going to do motor point on the lateral hamstring and possibly on the proneus. So I'm going to, sorry you won't be able to see detail, but anyway, for now, once I get the needles in, I'll bring the camera back and I will show you some detail. So I'm going to start with the glute medius minimus. Actually, the other thing that I'm doing is I'm just going to needle the sacroiliac joint. I learned this actually from a yoga teacher years ago, the concept, and I found it to be quite accurate that if you okay? Wow. Take a nice breath and exhale. If you release the sacroiliac joint, oh, that went in beautifully. Wow. You release the SI joint, and that also gives, the enemy of pain is movement. If everything in the body is loose, then your body has a chance to heal. Putting the needles in here has a direct anti-inflammatory effect in the area where the needles are. It also is, by needling the motor points and trigger points, we're causing the muscles and fascia to lengthen, again, so we get more movement. And then, of course, there's always an endorphin effect that has a relaxing effect on the body. And there's also evidence through functional MRI that when you needle particular points in the body, areas of the brain having to do, and this is through the sensory nervous system, which is how you know that somebody's touching you. That feedback loop is the sensory nervous system versus the motor nervous system, which is how you punch yourself in the head. And so the parts of the brain, and that's specific to acupuncture points, like a point for problems of the eye causes the part of the brain that has to do with the eyes to quote-unquote light up, to be activated. Now, I did the SI joint, and now I'm going to do the glute medius minimus on this side, and I expect it to be probably a little bit more, sorry if my shoulder's in the way. Where's the bone here? Okay, so you tell me, is that, yeah, right there? Yeah. Okay, so that's one, and I'm going to get them into the skin so that I can then stimulate them with my hand while holding the camera closer so you can see the fasciculation. The fasciculation is when the muscle jumps a bit. So how about here? You feel that? Is that a strong one? Not too much. Okay.
Oh, there. Ah.
You okay?
Yeah.
All right. So let's find the piriformis. And so, greater trochanter, hiatus of the sacrum, about 1/3 of the way. Right?
Oh, yeah.
That hurt a lot.
That hurt.
Okay, that's the piriformis. So the interesting thing about the buttock muscles is they're an area where we can carry tension just like we carry tension in our neck and shoulders. Now when I pressed there, did you feel it down your leg or it just hurt where I was pressing?
Yeah, I kind of felt it down. Yeah, down the leg.
Down the leg. Okay, so that's because your nerve. So when I pressed on the piriformis, he felt it down his leg, and what that tells me. Oh, there we go. So you feel that move?
Yeah.
So what that tells us is that his sciatic nerve is inflamed, which we already knew because of his pain pattern. And the sciatic nerve passes right underneath the piriformis, or between two branches of the piriformis sometimes. So let me just feel around here before I needle. How about there? Yes?
Not particularly.
Not particularly. Okay. All right, okay.
Wow,
So
that went down the leg.
yeah, so that's
That was good.
that's also the piriformis. So let me so that's not in very deeply. You felt it down your leg still, or just for a split second?
It was like a big release down my leg.
Oh, so a good thing.
Yeah.
Excellent.
I felt like a beautiful, like. Yeah.
Oh, like an open feeling of. Yeah, I know exactly what you mean. So I'm just going to show. So this is the needle. And the lifting and thrusting technique is this.
Oh.
So normally I would use two hands. So there we go. You okay?
Yeah.
And that can release the muscle a bit more. And let's. You feel anything on this one?
I do.
Okay. And then, boy, I need to get a light because the light is very distorted. And my battery's about to go out. I didn't notice.
Ooh.
There we go. Boot medius minimus. So that's all for now because the battery's about to run out. But I am going to do some at least one motor point on his lateral hamstring, also to release the sciatic nerve. And then I'm going to poke around. There'll either be one up here or on the side. Sorry, I wasn't. There'll either be one back here or on the side. And then to finish off, I'm going to do an acupuncture point combination, a point just below the lateral malleolus on this side, and on the side of the hand on the other side. And that's an acupuncture point combination that opens up the flow of chi through the spine. So I'm combining the best of both worlds. Dry needling based on the location of trigger points, and motor points, which is based on a knowledge of Western anatomy, with some acupuncture channel theory. Okay, well, thank you for tuning in. This is Eitan Shalom at the Body Mind Wellness Center, and we'll see you next time.